I'm a CPR.
This meeting is being recorded.
I am
Sorry
a
about
CP. That's okay. I'm a CPRS from Tennessee. I'm also just here to help, and I know that I am a health guide in the Pine Hill Health Network.
Yeah,
So-
and for those other ones who may have not seen Jackie at one point or another, she also does our plant teachings for us. So if you log in or you see it dropped on Pine Hill Health Network and you want to participate in the plant teachings, Jackie does that. And she does work via satellite. For those of you who don't know, she's out there in Tennessee. I hear your train going by.
Oh yeah, I live really close to the train track. I'm actually in a beautiful town called Philadelphia that is actually one of the Civil War battlefields that nobody knows about. And I live like right across from the battlefield. It's awesome. Also, so tonight we're actually going to be making that from this weekend's plant teaching. We're going to be doing poop tomatoes, and I'm going to go into a little bit about the poke dye, but we're actually going to have to do it this Friday when I actually get some pokeberries.
Wonderful. Thank you, Jackie.
You're welcome.
I know that's not Kathleen Chavis. That looks like Louis Chavis.
It is I in the flesh.
Would you like to introduce yourself, kind sir, since you were not with us last month?
Well, actually, we had a death last month. Okay, believe it or not, I talked on the telephone about 7 o'clock in the morning, laid down for a couple of hours, but slept through it. I'm Louis Chavis, chief of the Beaver Creek Indian people, okay, out of Orangeburg County, South Carolina.
Welcome.
Thank you.
It's nice to see you. I'm in
The
Orangeburg.
microphone is working. I can't believe it. Go, girl, go.
Yeah, I know. Like I said, it's nice to see you. I'm in Orangeburg too. You know, I'm familiar with a few of the Beaver Creek. And you're welcome to stop by Coburg Lane anytime, especially if you need any regalia. I'm right here.
I know where it is. I know where Coburg is. Yeah. Thank you.
That's where I'm at. So last month, I'm just going to go over real brief a couple of minutes that we took and things that we did in last month's meeting. We had Dr. John Creel with the Edisto participate in that meeting. Chief Nelson, of course. PD had sent 2 people. I think his name was Rick Ladine. Correct me if I'm wrong, Chief Mitchell. Mitchum, I'm sorry. And Brian Tanner. I think Chief Pard logged in, but only for a few minutes. Ms. Gaillard, of course, I've already introduced from Minority Affairs. We also had the Seattle Urban Indian Health, our grantor in that meeting, Mr. Thomas Lawrence. Felicia Cavallini from Limestone, who also does some data for us. And Mr. Britton Brown with Minority Affairs was also here last month. Now, in our brief discussion that we had last month, which turned out, I think, really well, because this all was to give you a seat on the health committee. The health committee is for all people. It's for all of our people. It's for all people. And the reason that we put this together with our grantor is because what they're looking for is just data. You know, for services that you may or may not be receiving, for health concerns within your own tribe. Everybody's going to be different, but we want to give them the data. And the reason that we want to give them that data is because we want to receive programs like the ones that we offer through Pine Hill Health Network free of charge to anyone. We want to continue to be able to offer those programs. And in order to do that, we have to return data back. And if they want to add new programs for new concerns that may be a part of your tribe or a part of the minority population here in South Carolina, so we can add new programs later on to tailor those to what we need here. Now, at this time,
I'm sorry, Kay, I wanted to interrupt for a second. Chief Sekou General called. He can't get in through the Zoom. He doesn't have Zoom, so he's listening on the phone.
Okay, thank you.
And he's with the Yamasi.
Okay. please make sure we get that in the notes so I don't miss out on anybody next time. Thank you.
Okay, thank you.
So last month, we had some packets go out that were requested of everyone. I think Chief Nelson, I know PD, Dr. Krill, packets were sent to Minority Affairs and to basically everyone that was in the meeting last month. And those packets included screening forms, referral forms, some brochures, pamphlets, pins, and some other things, some other information about Pine Hill Health Network and the programs that we offer so that you can disseminate those to other people within your tribe or within your area in which you are. We also sent a comprehensive packet to Minority Affairs because they had offered to disseminate the same information as well. And a letter was to be drawn up to accompany that information before Minority Affairs disseminated. It's my understanding that they should have the packet, but Chief Mitchum will be compiling the letter to accompany that information, and she's going to send that directly to Minority Affairs. I think it's just going to be a brief explanation of what we do, how we do it, what programs we offer, so it can go out with the packets that Minority Affairs is sending out. Also, we sent out a copy of a survey, which we're asking everyone to participate in this survey. I know it seems a little lengthy at times, but it would literally take you 5 minutes. If you participate in that survey and we get the responses back, that is data that we can use to continue with our programs that we offer to everyone. There were some suggestions made to make some changes to that survey so we can cut out a couple of questions. So maybe it'll be a little bit shorter. We reviewed those changes and we agree that some of those changes need to be made. So we have taken down the survey link temporarily in order to make those changes. So once those changes have been made, we will send out an email and the link and say, okay, it's now available again. That should happen in the next few days. So you may receive an email if we have your email address on file of the new survey form with those changes that were made. So that's one of the things in the meeting last month. And we are looking forward to having some more participation. And we appreciate you guys coming out this month to find out what we have going on. So everyone that was here last month was guaranteed a seat on the health committee. Unless you designate otherwise, Chief Chavis, this is your seat. If you would like to designate someone other than yourself to have your seat on the committee, if you would just send a quick email over to us and let us know who that is so that we can make sure that they get the information they need to keep up with the monthly meetings that we will be doing.
I thank you, but I imagine it will be me. Most of my people do not have a computer or either access to the internet.
Okay, and that is a great concern. I appreciate you sharing that with us because this survey is an online survey. So if we need to provide a hotspot and a computer somewhere in your area that will allow them to be able to come complete that survey 5 minutes, then we're happy to do that. If you could maybe talk with them and find out when would be a good date and time for us to come, we're happy to bring 2 computers and bring a hotspot and see if we can't get some folks to complete that survey.
Beam me up, Scotty. Hot dog.
No problem. We can do that.
Thank you.
And the same goes for anyone. If you're having some internet issues, people don't have access, we do have hotspots available or we can make them available to you to be able to do this. I know, Chief Chavis is right here in Orangeburg, so he's going to be an easy one for me to get to. But Chief Nelson, you're in the upstate up there, and but so if I need to make a date and a time to get to you, then we can do that as well.
Well, I appreciate that very much. Most of the area in the upstate has access to the internet, I don't see as that a problem, but I did want to tell you that I did receive the package that Chief Mitchum and yourself mailed here. So I got that last Saturday. I just wanted you to know that.
Thank you. Chief Chavis, we may need to send you a packet as well, or if we can meet somewhere, we can even just hand them off to you.
I'm game. I'll be
Okay.
back in touch with you.
All right, that'll work.
Okay, the package for the Beaver Creek and PAI is being mailed out, and Chief Sekou General that's on the phone with Yamasi, they're in Allendale. And one of the biggest problems they have in Allendale is internet. And Sekou, did you want to speak on that real quick?
Chief Mitchum, I'm not hearing the audio. I'm sure he is sharing.
Let me see if I can turn it up. This is as far as up.
Okay, can you hear me now?
Yes.
All right.
Chief, we hear the puppy way better than you.
What is it?
He said he could hear the puppy better than you.
I
I'm
heard
not
him.
sure why
All right,
this
but
is
yeah,
being-
it is a battle that we have taken on across the internet. We are getting a little traction. And I have been implementing some new technology, some wireless technology, to be able to accommodate us versus having to run fiber. But at this moment, we are utilizing AT&T FirstNet for first responders internet systems for us right now. And that's because I'm a firefighter and at EMR. So we've been trying to basically accommodate our situation utilizing services like that.
Okay, it sounds like it would be a valuable trip for us to come down there with a couple of hot spots too as well.
Well, we will definitely be able to provide pretty much have it. We have it in hand, we have it under control. Just that last mile for us getting on because we do have a centralized office and we have several businesses in Allendale. If there's surveys that happen, we can bring out one of our office locations and have them done.
Okay.
Now, Chief Gentle, are you saying that you don't need us to come down to help get the surveys done, or?
No, we're fine.
Okay. All right. And I wanted to add, Kay, that the same link is on our Pine Hill Health Network Facebook page, and that is where the survey raffle is. If they fill it out through Facebook page, they're entered into a raffle, and the raffle item this time is a men's traditional bustle.
That should get something going. Thank you. Okay, well, I just want to make sure let everyone know, our goals here are to develop and deploy tribal community health worker services to reach and serve all tribes and the communities and the citizens. We want to collect and establish some baselines with them with some data collection. So the more people we can get to complete the survey, and like you heard Chief Mitchum just say, if they complete the survey through our Facebook page, they will be entered into a raffle for a men's traditional bustle. Pine Hill Health Network is doing this in collaboration with the South Carolina Commission of Minority Affairs and developing the health profile for American Indians in South Carolina to help us supplement Healthy People 2030 statewide initiative. So that is our end goal. And like I said, I'm here as the office manager, plus I am a program director with Pine Hill Health Network. And I want to make sure that we were crystal clear, because I know we had some questions after our last meeting as to what we are doing, what you can expect to receive from us, and what we would be requesting from you in return. I want to be real clear. The only thing we're asking for from anybody is your data. We really, in a lot of cases, I don't even know their name. If they don't want to share their name, they don't have to share their name. We're not even asking them basically, prove to me that you are Beaver Creek. I'm not asking for that. I'm just asking for health profile data. I know, Chief Nelson, you had expressed some interest in doing an MOU with us so that we can provide you with blood pressure monitors, scales, and those things that you would be able to implement at certain, and hand out to people who meet those profiles. Chief Chavis, of course, we would do the same for you if you were interested in an MOU with us, which is just an agreement that says we're going to provide these services with you and for your tribe or the tribal community in your area. And in return, we're just asking for the data so that we can turn that data back around to develop the health profile for the American Indians here in South Carolina.
Let me say this also. Chief Mitchum's aware of this, and Chief Chavis is probably too. At our powwow that we're going to have May the 6th of 2023, it's in the same location we had last year, and the Pine Hill Indian Tribe came up and set up a tent. But also, I'd like to have the Pine Hill Health Network also to come up and set up a tent there so that we can make your company and your health network, make it more aware in the upstate to the people up here, because I've asked a lot of questions and a lot of people don't know you're there. So if we could set that up over there at that powwow that we're going to have next year, maybe we can have people learn who you are and maybe ask you some questions.
We were set up. Pine Hill Health Network was at the last one. We were giving out the same brochures and everything.
Yeah. Chief Nelson, I really enjoyed being at your powwow this past year. My mother is the one that you gave the honor shawl to.
That's true. Absolutely.
Yes, sir. And I'm just giving you a quick update. We went to the doctor today. They're going to do radiation on that spot on her lung starting. I think we go back Monday to get set up to get that started too. So we're making progress, sir.
Well, I appreciate that very much. Keep me informed about her. She's a real special person, and it was an honor to be in the circle with her.
Yeah, she is something else today. I had to vacate from her house today so I can get over here to get this done without Mama going, "What are you doing? What are you doing?"
And to circle back on that, with the Pine Hill Tribe Chief was there, but Pine Hill Tribe was not. That was the health network that set up. And we gave out over 700 brochures and all at Chief Nelson's powwow.
Yeah, well, it'd be an honor to have you back there too.
We also did Hardyville. We went to the powwow down in Hardyville in the what seemed like tornadic type windstorm, and then the following freezing cold to the insides of everybody. We did set up down there as well in Hardyville at that powwow, and really noticed that we had the most interest whenever we offered a raffle or a giveaway. That's when we got a lot of people to come around and visit our booth and say, okay, check my blood pressure because I'm going to get entered in this raffle, or I'm getting entered into this giveaway. I think we gave away grass regalia
Yeah, we
down
did.
at Hardyville so that we can get people to be interested. So any help any of you can provide in getting the word out about Pine Hill Health Network. I mean, and I say this all the time to people when I talk to them, it's like every program we offer is free.
Right.
It costs you nothing. The only thing we're asking for is data. And even then it's not so much data that you feel like you're giving away all the answers to your entire life. It even is a minimal amount of data. And nothing that we get, any kind of data that we get, because we are Pine Hill Health Network, we are bound by the same state laws of HIPAA and the same federal laws. We don't share that information, not that personal identifiable information. We don't give back your name and your age and where you live and your phone number. We don't share that information. The data that we share with Minority Affairs and the CDC is basically just the health profile data. It may contain your weight. It may contain what your blood pressure was when you started the program, what it is as we progress through the program, if you are part of that program. But we don't share your personal identifiable information. We will not share any protected health information. So what happens between you and your doctor is not our business. We're interested in the data, in the health profile. We have a lot of people who probably could be participants in our tobacco cessation program. Or, there has been programs offered that we put out there that we've not gotten participation in because, like Chief Nelson said, a lot of people are unaware of this exists. Well, we want to make everyone aware this exists. We have a tobacco cessation program. We have a blood pressure monitoring program. We have a type 2 diabetes prevention program. We have the Indigenous First Steps program. We offer the plant teachings. We have all of these programs that a lot of people can benefit from. And a lot of it can be self-care. This is what you can do for yourself. You can monitor your blood pressure every day. You can go look at it. You can see what your numbers are. If they're elevated, then, somebody on the other end, whether it's myself or we have a CNA in the office there Monday through Friday, will say, okay, this person you may need to contact your doctor whenever we're looking at some of these numbers that may be too high. We do refer out. We will ask you, if you're taking medication for this and then it's a consistent problem. We are not a clinic, so to speak. We do not treat patients as in you come in and I'm going to check all your stuff out and then I'm going to write you a prescription. That's not what Pine Hill Health Network is.
No. And I just wanted to reiterate too, Kay, that the health profile that this committee is working on and the health programs that Pine Hill Health Network offers, the programs that are offered at the health network, they are monitored by a medical director. And
Yeah.
we do biodirectional work where if you do have a primary care physician and they've referred you to, let's say, the diabetes program, the information is shared. That all of that is pretty standard for all of those programs and has nothing to do with the health profile itself. That's just in the progress of the program for the individual.
Right.
Yeah.
So you know, we don't share your personal medical information with anyone. That's between you and your doctor. If you are a physician's referral and the physician is asking for information, of course we will comply with that and give them the information, but that is always done with your permission. We don't just blindly say, okay, we're going to send this to here. No, we don't do that. But I think the big selling point is that we need to get across to everyone is these are free programs. It costs them nothing. The participation in some of the online programs has been really lacking. I think that was brought up in our last meeting as well, was there was the tribal participation was very lacking. And I think it was the tobacco cessation one that had come up, and we were looking, and there really was no one from South Carolina there. There was no representative of anyone. So we would like to see more participation in these programs that we got going on, and it's only for their benefit. It's nothing that is against anything. I have heard where a couple of people say, well, I'll do it, but we have to go ask the chief if we can do it, or we have to go before tribal council and say, is it okay for us to participate in this program? And I think the reason that comes up is because it is called Pine Hill Health Network. Pine Hill Indian Tribe is not pushing their tribe into your tribe or into that tribal community. Pine Hill Health Network would like for their participation is what we're asking for. The Pine Hill Indian tribe is separate and apart. So I just wanted to make sure that we had that all cleared up, even though Chief Mitchum is in here, and she did the grant work to get us what we needed to be able to offer these programs for free. And we really appreciate her for all of that she does behind the scenes. But she does that as a volunteer. She does not do that as I'm chief of the Pine Hill and I'm coming in and telling you what you need to do. So that is the reason we're doing this little bit of shift, so that we all know that Pine Hill Health Network is separate and apart from Pine Hill Indian Tribe. Chief Mitchum, I hope I've made that abundantly clear. I hope that you know how much we appreciate everything you do voluntarily behind the scenes to make all of these services, all of these programs and everything run smoothly, and to help be able to give this for free to all of the Native Americans in the state of South Carolina. And in some of our programs, it's not even exclusive to South Carolina. We can offer most of these programs even outside of the state of South Carolina. So Chief Mitchum, I hope that you understand that we are in your debt and eternally grateful for everything that you have done to bring these programs for us to be able to offer them. And I appreciate everybody who is attending today. And of course, we will have the minutes of this meeting, and we will have the recording available as soon as we get all of that worked out and downloaded and reloaded back to where it needs to be. At this time, I would like to open the floor for any questions or comments, any request, if there's something that we can do for you, or if there's something that we can do to assist you in your areas, or if you just have any comments or suggestions on how we can get this word out to spread it amongst all communities.
I'd like to add, Kay, that, and this is additional to what you were saying about Pine Hill Indian Tribe. Pine Hill Indian, and I don't mind sharing this with everybody, my tribe has an MOU with the Pine Hill Initiative that operates the health network. So, you know, I've come under a considerable amount of attack here over the past week. And we're just going to leave that there. My tribe, yeah, my tribe is also an MOU participant in the health network, and and Chief Chavis, Chief Gentle, you know, and even Chief Nelson, he drives through here, this area on occasion, and you know what we're dealing with down here, with broadband issues and things like that. And Chief Chavis may be the, other than Kay herself, I've got some very stubborn tribal members. And you know, I'm a big cheerleader for the diabetes program, because of my tribal members, but my tribe, I don't know how to make that more clear than what Kay explained. The initiative is the parent of Pine Hill Health Network. And I know it does, I guess, if I were coming into this not knowing any better, I would probably think about all this being extremely confusing, but it's really not. The only reason that I'm the director of the health network is an ex officio spot. The head honcho here is our medical director, who has been on vacation and not able to attend this meeting because of another meeting that conflicts with this one. But I did want to reiterate, you know, I've been pretty silent about the activity of the past week because I have been busy with my own mother, who's been in the hospital the entire time, and is one of the people who inspired me to start pushing towards a health network. You know, we just don't have the enmities that the larger cities have. Charleston and Somerville, Ladson starting to boom. Berkeley County's got a new hospital, basically. We just don't have that here. And so this was vital to push forward. So again, just reiterating, because apparently that's very recently become an issue that Pine Hill Indian Tribe is involved with Pine Hill Health Network.
Thank you.
All
Thank
right,
you for that clarification.
I've got a question. The person that I'm not aware of, I haven't met him before, I don't think, but the person that does your plant teachings, at some point, yeah, at some point in time, I would like to talk with her. When I was a child, my grandmother taught me about some plants and so forth that I could use to make medicines, and I've always had an interest in it. And so I'd like to meet that person one of these days and be able to sit down and talk with them about different plants.
I
Jackie
would love to
Lynn
do
is
that.
actually on here, and Jackie Lynn, this is Chief Lamar Nelson. Hello.
Hi.
Maybe y'all can exchange information, Chief Nelson.
Yes, Jackie, you know, my grandmother said that her mother was a medicine woman, and so I could tell you some stories at length in the future about some of the things that I heard when I was a child. But I do have some interest in plants that you can make medicines out of, and dyes, and all kinds of other things. And so maybe at some point in time, you and I can talk or meet together one of these days, and let me ask you some questions.
I would love that. And I'm actually trying to plan a trip right now up to Black Mountain to work with Cindy Quay. She's from the Winnipeg Nation, and she's going to show me some more stuff about, I don't know if you've ever heard of ghost pop.
No.
Okay. I came across it and I wanted to work with it, but she told me that I wasn't allowed to without learning something else. So yeah, I would love to come up to South Carolina. I need to actually make a plan to come up there and meet with everybody, because I know that a few people have seen me in person, but a lot of people haven't. So I'd love to come up and talk to you, because I mean, that's the reason why I do plant teaching, is because we need to share what our elders passed on to us. Because if we don't, it's going to die, and then nobody's going to know how to make medicine.
Well, Chief Mitchum has all my contact information.
Okay.
You would get with her. Maybe you could send me an email, and maybe at some point in time, you coming down in South Carolina, we can meet.
Okay, that would be great. And I'll get with Michelle after this, and we'll get everything going.
All right, thanks.
You're welcome.
And Kate, just to make sure that Chief General is not missed on this, their community health worker was Earth Hajo. And I believe, didn't she move?
She's currently in Virginia.
Yeah, she moved. So the community health worker spot for the Yamasi is unless I'm wrong, Chief General, that's pretty much vacant right now.
Yeah, I'm gonna fulfill that spot. We can find someone else here locally to do that. However, I did want to say, while I have the floor, interested in the Native First Steps program, and want more information about that, Chief, because I think that would do great here in Allendale.
Okay.
Do you want us to send you a package along with the other two that are going out?
Yes, please. Thank you. Yeah, definitely on that. We have a lot of tribal members that have been interested in some kind of program that we could initiate here on our own outside of Allendale, and I think that will be. Well, I'm not sure how that actually works with you guys, but definitely be wanting more information.
Okay. We're happy to get that Indigenous First Steps information out to you, Chief. And Chief Mitchum, you're sending him a packet as well. We could just include that.
Yes, ma'am. And I don't remember who, might have been you, Kay. Someone said there was a donation, another donation of baby formula.
Yep, we had baby formula, and actually we had baby food get donated as well. So
Wow.
we were able so far to distribute the baby food and the formula right now, especially during the formula shortage. And, you know, the formula was for a child that was under the age of 3 months. Of course, they not ready to have food yet, but it won't be long before we have some that are ready to have baby food, rice, cereal, those kinds of things. So we do accept those donations. If I have to go pick them up, I'm happy to go do that, as long as it's within reason, of course. You know, it's gotten to point now where it costs less to ship it than it does for me to go fill up with gas and go get it.
Yeah.
I mean, that's the truth. I'm sorry, but it's the truth.
And also, I was contacted, I think yesterday or day before, at some point over the weekend, I was contacted about clothes, kids' clothes, and I told them, yeah, we'll take them and redistribute them. And also something else that I wanted to make sure was brought up that I just thought about. I've forgotten the name of the place. They emailed, and I forwarded that email to you, Kay. I cannot think of the name of the place, but it's a blood drive.
Yeah, that's Blood Connection.
Blood Connect, that's right. And my thought was that this Saturday would be too soon, but the next in-person gathering that we have for August,
Yeah.
maybe get them down involved in that.
Yep, we can definitely do that. I think our plan was to have that in North at the office. Right. Outside. They have a mobile unit, so we can pretty much ask them to go where we can need them. But I think that parking lot area there is probably much better access for everybody who wants to come in. If they want to come in and donate blood, that gives you a place to park. It also, we would be able to open our office there. So if they need to use the restroom, come in and cool off, depending on how hot it is in August. If July is any indicator, we in for a good one.
Wait a minute. I heard you say we're gonna donate blood, right?
Yes, sir. You're going to give it away.
Oh Lord, no. See, we got a money making thing here about selling platelets, okay? But I'll share that information with you.
Yes, sir. Share that with me. But okay, if there are no other comments, Chief Nelson, maybe I'll dance next time I show up in May.
That would be fantastic. We'd love to have you there dancing.
I have to get a jingle dress ready. I might be able to keep up with that. I'm not sure.
Well, we're looking forward to it. Looking forward to seeing you.
Chief Chavis, we appreciate you coming in with us this time. Hopefully we'll see you again in August. We, of course, I will be sending out that information as far as the date and the time. If 5:30 is still a great time for everybody, then I'd like to do it again at 5:30 in the afternoon. And it sounds like a selfish reason, but most of us have a lot going on during the day, whether it's another job, whether you're trying to get stuff done around the house, kids in school, grandkids coming home and all that. So 5:30 is actually a very good time for us here. So if it's a good time for everybody else, then I'll ask Chief Mitchum to send out the date for August meeting and the time. I think we decided we were going to do that on the third Mondays, or did we say second Monday of the month?
The in-person gathering is the third Saturday, I believe. This Saturday is the in-person gathering at the office.
Right. So, and of course, everybody is welcome to come there if you'd like also. Every third Saturday of the month, we do an in-person gathering at the office, Pine Hill Health Network's office, located in North South Carolina, right on Savannah Highway. If you're familiar with the North area at all, it's right next door to the R&J drugstore. So, Chief Chavis, I'm sure you probably kind of have an idea where that might be.
Oh, exactly. Thank you.
Mm-hmm. So anybody is welcome to come and be there for that gathering. And actually, if we have enough people there, we had discussed before doing a cancer talking circles. We have people available for that. Seeing how these programs work, you can come and be screened during that time if you like, or if you want to come and just sit around and share, like Jackie and Chief Nelson, share plant teachings, share what goes on in your tribal community that you want to pass along so people have an understanding of what it is like. Even if you want to bring, I think last time I brought some regalia, some ribbon skirts. I brought my sewing machine. So if you wanted to learn how to make a ribbon skirt, you know, we have somebody there that we're willing to share that knowledge, willing to share those skills with other people, or even to teach those skills. So if you have something you would like to bring to the table, you're more than welcome. And that's going to be every third Saturday. We start at 10 a.m. We usually get up there a little bit earlier than 10 a.m. But everybody is welcome to come to those gatherings. It's every third Saturday of the month, located at the Pine Hill Health Network office. We have plenty of parking. And you're welcome to come and share and participate in any of the programs.
And one more, a couple of more things I wanted to make sure we covered, Kay, that I just thought about. Jackie Lynn that does the plant teachings, and our lifestyle coaches and all at the Pine Hill Health Network. When we expanded, we started getting interest from other states. Jackie is in Tennessee, so she represents Pine Hill Health Network in Tennessee. And Jackie had shared with us a couple of months ago very exciting news that the Department of Mental Health wants Pine Hill Health Network featured at their conference, and that's in September, right?
October.
October.
They
Mhm.
wanted me to do the same teaching I did on Teen Talk, was it?
Yeah.
Mhm.
Yeah. Sorry, I'm
October.
out in the country trying to find some poke.
And Michelle Jones is promoting Pine Hill Health Network as I guess an ambassador for Pine Hill Health Network in Georgia.
Mhm.
And I think it was Thursday or Friday, I got a request. This goes back to what you were saying about the ribbon skirts at the office gatherings on those specific Saturdays. The request was made for beading, and I was called on a personal level because I do a lot of beading, but it's turned into a conversation about turning beading into a session. So that might be another way we can entertain. I'm not sure how we would be able to, I guess the logistics of it would have to be worked out, but we could actually turn that into another data collecting tool.
Yeah, because my beading would cause anxiety if somebody had to look at it.
You what?
I said my beadwork would cause anxiety if somebody had to look at it. I'm not really that good at it, Chief.
Well, look here.
Um,
I need a favor from y'all. Anybody,
Yes, sir.
somebody from the Pine Hill Health Initiative, come join Beaver Creek on the 3rd Sunday afternoon of August and tell my people about it when we have a little gathering coming off. It's going to be ice cream social days. You can eat all the ice cream you can hold.
I don't know if you make enough
We know-
ice cream. I can hold.
Wait. Right. Okay. But there won't be any scales involved. Okay.
It's calorie free. We don't charge for calories on the 3rd Sunday, right?
Oh, Lord, no. See, I'm still quite interested, like Chief Lamar Nelson over there, about you need to put my name in the raffle, okay, for this bustle. That's all I need right now at 73, okay? No, I'm serious. It's 74 to be truthful with you, okay? Oh, yeah, that's what I need, okay? But you want to write me in, okay? Louis Chavis, Chief of the Beaver Creek, 6'2", 225, the man of steel with sex appeal. Y'all got it?
Lord, I love you.
so you,
You
Chief-
know what, Chief Chavis?
What?
I'm going to try to make it a point to be there the 3rd Sunday just to eat all your ice cream.
Come
Who's
make,
turning those turns? Are you?
come
Are
make,
you?
come make
you
yourself at
turning
home.
the turn?
All you have to do is just talk about probably 10, 12 minutes, okay? All right.
All right, I can do it.
Matter of
now,
fact,
all right, to clarify for notes, is it August the 3rd or the 3rd Sunday in August?
3rd Sunday afternoon, 2 o'clock.
You know, I'm about to look that up right now on my calendar and give you a date.
Okay.
We're gonna make a date, but don't tell my husband.
Oh Lord, no. See, I'm a free bleeder. If I get hit in the nose, it goes downhill real fast.
There you go. That would be 1, 2, 3, the 21st,
Or 8/21.
August 21st.
Okay, so we have Pine Hill Health Network has hit the Chief Nelson, do you have a problem with the acronyms ESHUIT?
I'm sorry, I didn't hear you say it again.
Do you have a problem with the acronym ESHUIT as a short, Eastern Cherokee Southern Iroquois United Tribes?
No, I don't.
Okay, so we've been to ESHUIT, we've been to Hardyville. We're
And Kay is going to Beaver Creek.
We're going to Beaver Creek, going to Tennessee. Chief General, do you want us to come to Allendale? Is he still on? Let me see. I think he might have muted.
Well, if you would please share with him when he unmutes that As a part of the Indigenous First Steps program, we will be providing those blankets, you know, the nursing canopies and that stuff to the new moms.
Okay,
And
yeah.
he can get in touch with me about how many he thinks he will we will be needing to provide for him down there.
Yeah, the way the programs are is the participant enrolls into the program, and once they're enrolled, that's
Yep.
sent out to them. Yeah. Same thing with the blood pressure monitoring program. The monitor is mailed out. They have to sign a form saying they received it. Because we have to track the monitors. And then the diabetes program has its own enrollment form. Teen Talk. I would like to see Teen Talk, and I've said this before. I'd like to see Teen Talk do another art contest. The one that was done before the pandemic. It was awesome the way that the kids responded to that. It was really, really good. And I thought maybe I don't know about Facebook. Facebook will not let us run ads saying Native American anything. So maybe Teen Talk could initiate that was the Stay in Your Lane campaign. And COVID prevented that for 2 years. We did not get to do that art contest. I'd like to see the art contest come back, even if it's not during February. October's coming up. That's Domestic Violence Awareness Month. So I guess being formal, I moved for Teen Talk, Stay in Your Lane Club, the art contest
Okay.
in October, or to be finalized in October.
All right, that's something that we can share with the health committee people whenever we take it out there and try to get some more participation with the younger folks.
Do we want, I guess the motion is to just announce it and make it, go ahead and put it out now. That way, all of the participants, we can give it to Minority Affairs, they can put it out with the brochures. The tribal communities can put that information out to their youth, and that way the Native kids can participate in that contest.
Okay, is that a motion you want to put before this health committee or something you want to put before Pine Hill?
I'd like to put it in front of the health committee because I think that's another good tool for data collection.
Okay, I'm good with that. I'll second the motion that we do an art contest for the Native children. Everybody in favor?
Aye.
I got aye.
Aye.
Go ahead, yes.
Yes, all right. I think that's a unanimous decision there that we can do that.
So
And that's going to be in October.
It'll be finalized. We'll do a draw date, I guess on Halloween.
Okay.
So it'll be geared toward domestic violence awareness and dating violence awareness.
Okay. If you can put that together so we can disseminate it, that'd be great.
Right.
I'm writing it down on my notes too, so I don't forget. I know you got the notes, but I'm writing it down.
I'm trying to remember, what did I just say?
The art contest is going to run for the month of October till the 31st, with the winner being announced on the 31st. And the contest, I guess you'll put the rules there in the flyer about domestic violence awareness and
dating, yeah, teen dating, violence awareness, right? Yeah, I guess the reason we got sidetracked on that was because we had that guest speaker speak on the teen dating violence issue, and the response was so much more overwhelming than we anticipated it would be, and the contest went to the wayside. But I do want to get that out.
All righty. Thank you.
I would
All right.
really like to do a walk with people and show them what is all in the forest that can be actually used.
You said a blog?
I think she said a walk.
A walk. Sorry, I'm in the Yukon. I'm on the search for some berries.
Did you say a blog?
I would love
or-
to come up to South Carolina. A walk, like walk through the woods with people and show them what's what.
Oh, what cannabis is. I'm game.
That sounds more like a health network.
Yeah, it is.
Yeah, health network
Chief,
conversation.
I bet you can find some kids out there and show you right where it's at.
You know what? At 74, I've never burnt one. I've been too interested about other things, buying duck decoys and shotgun shells. Okay.
There you go.
So, all right, I'm finishing up that note about this new art contest for data collecting as a data collecting tool.
Yep.
And
I don't see none.
that's all I can think of. Seku's call dropped, so I don't think we'll have any final words from him unless he calls back.
All right. Well, if you have anything else, then we're going to call this the end of the meeting. I'm about to stop the recording. And of course, if something always comes to your mind after you leave one of these meetings, so feel free to shoot us an email or a phone call or something like that if you thought of something that maybe we missed or we need to touch on in the next meeting. Of course, you could send out an email or a text message or make a phone call to Chief Mitchum, to myself. I think all of our information is listed on the website, our contact information, email addresses and stuff like that. So, but if you do need that, of course, reach out and let us know. So if there's nothing else from anyone else, I'm going to stop the recording right now.
I would like to make the motion to adjourn.
Okay. Anybody want a second?
I second it.
I got it.
I'm good
We
with
all
that.
agree?
For the love of God, it's a spider.
I'm stopping recording on that.